I think those foundationals are in fact changing the way we can build applications in pathology, the very same way foundation models outside of pathology are changing other industries. The way to think about it is every time you're trying to derive insights from pathology data, you need to actually understand the data set itself. And ultimately, what you need to do is understand the morphology of cancer. Those foundation models capture that information. So instead of reinventing the wheel, you basically start from a baseline model that ultimately have an intrinsic understanding of images, and you're only focused on building your downstream application.
Welcome to the People of Pathology podcast. I'm Dennis Strank. On this podcast, we explore pathology, laboratory medicine, and forensic science. The use of AI in pathology has the potential to transform our field. This is even more evident with the emergence of foundation models. My guest today is Razik Yousfi, CEO of Paige. We discuss the importance of data diversity in AI and the impact of foundation models. And we'll also talk about how industry collaborations can increase the rate of innovation. All right, get ready for a fascinating conversation with Razik Yousfi. You are the CEO of Paige, and I want to start there. Can you tell me a little bit about Paige? Can we give kind of an overview of what Paige does? And then I want to get into kind of your rise to CEO.
Yeah, absolutely. So Paige is a company that focuses on AI for cancer diagnosis. So ultimately, what we do is we build AI solutions, deep learning algorithms, and products that can be used to identify insights on histopathology slides. So we started as a spin-off from Memorial Sloan Kettering. We've really been trailblazing the space of artificial intelligence and have demonstrated our ability to identify suspicious cells in slides over a multitude of cancer types over the years. We originally started in prostate, then went to breast, and more recently have been focusing on really doing everything on the multitudes of different cancers, whether they're common or they're rare. Beyond being able to identify cancer, we also provide solutions that can be used for better understanding the types of cancers, grade them, quantify them, but also ultimately go beyond what a pathologist can do with the naked eyes by identifying some of the biomarkers associated to those images by basically training very, very large systems.
As far as your career with Paige, how did that start?
Yeah, I joined the company in 2019. So my background is in computer science. I spent most of my career in technology for medicine. I studied it by working at Siemens Corporate Research. I spent quite a bit of time in Silicon Valley working for a company that does AI in the healthcare space for the detection of coronary artery disease, where I stayed 7 years, joined that company as an engineer, left it running engineering. The name of the company is Heartflow. And in 2019, my former boss basically left to join Paige, which really put the company on the map. I really got intrigued by the mission, by the technology, by the possibility of using AI again to impact patients. So I decided to join. I initially joined as the head of engineering. I ran technology for basically 5 years. And my role there was to really build the team and mature the technology that was originally created at Paige through the spin-off to really bring it to the level of being able to be deployed globally, go through the FDA processes to get it approved and cleared. Last year, we decided to really recenter and focus the organization on our AI strengths and ultimately continue to expand our portfolio of AI solutions and products. So I also stepped into the CEO role to lead the rest of the organization to really embrace this new journey for the company.
What would you say would be like the biggest change as far as work-wise, like your job duties, I guess, moving into the CEO role?
It's a very good question. So what's interesting is in my role as CTO, you get exposed to a lot of the mechanics of the organization, whether they're talking to customers, talking to partners, interfacing with other functions, interfacing with investors. I think as you step into the CEO role, you really take accountability for the whole company altogether, and you're you're not only the point person internally trying to really set vision and strategy for the organization and inspiring people to ultimately wake up every day and work hard, decide to commit to some extent their life to what we're trying to do for the company as a mission. But also you're the point person externally, right? You represent the company. Everyone has a role to play within the organization, but people come to you first. And that's true for customers, that's true for partners, that's true for ultimately everyone that believes in the organization, right? Whether it is investors, patients, and so on and so forth. So that shift in the role is really around being able to embrace, I guess, the necessity to be the point person inside and outside of the organization and really drive things forward in a way that is constructive.
Was that easy for you to make that transition, or was that more difficult?
I don't think anyone, frankly, that transitions in this role will say it is easy.
Yeah.
I think that it is a different role, right? It is different to lead a technical team and ultimately being, I guess, looked at as someone that can deliver products to the market versus being the nexus of all the parties that I mentioned before. I think it's been energizing, but it has also been very challenging in a positive way, right? You actually have to do a different job.
Sure.
So I think the transition was easy in a sense that everyone knows me at Paige before and after. So I'm a very familiar face to the rest of the organization and to everyone outside of the organization. But it is certainly a different role that comes with its own set of challenges and rewards.
Okay. Okay. That makes sense. So I want to talk about Paige creating AI models, because one of the things I've learned over doing this podcast is AI models are only as good as the data they're based on. And for Paige, it seems like you're emphasizing creating these models that represent diverse populations, which is, I think, important. Can we elaborate on this, like the importance of equity in AI and AI data, and then maybe some of the challenges that Paige faced in accomplishing this?
Yeah, I think you're spot on, and that is a very good question. The quality of the data used to train AI models, especially in healthcare, has a massive incidence on the ability of the model to achieve a specific performance against a specific set of benchmarks. Because we are born from emeralds on gathering, we have the luxury of having this exclusive relationship with them, where we get access to the MSK data. The MSK data is extremely rich. It's probably one of the best data sets that you can find out there. MSK is a very prestigious cancer center institution. They see patients from all over the world. They have all sorts of cancer specialties. And as a function of that, we basically have not only a very large data set, millions and millions of images, but our data set comes from more than 800 institutions and 45 countries across the globe. So it ultimately represents a pretty diverse and global population. The other thing is our data set is a real world data set. In essence, it hasn't been curated specifically for AI training. So it contains all the sorts of artifacts that you can basically see when you receive a glass slide. So pen markings, bubbles, cracks, dust, and so on and so forth. So our data set is very unique in that way. And because it is unique in that way, we could ultimately really balance it out in a way that as we were building our AI solutions, we were capable of preserving some of the diversity of the data into the properties of our AI system. And as evidence of that, today, when we basically sell and commercialize our AI products, we do not customize them per institution. So we don't touch them, actually. We lock them, we tech them, we deploy them within any lab in the world, and they work out of the box. And the reason why they work out of the box is because they have been trained on such a diverse and strong data set. And we have customers today in many countries in Europe, in North America, in South America. And what we see is that the general performance of the AI system is really on par, showing that we have that capability of generalizing across institutions and labs.
Okay, I see. So these days, everybody's talking about foundation models.
Yeah.
And I know Paige has their own set of foundation models as well. Can you talk about these? Like, how do foundation models impact pathology, oncology, and cancer diagnosis?
Yeah, I think, the term is a little bit overused. right? So it's been certainly in hype, and I think the
Yeah.
definition of a foundation model is maybe subject to interpretation, frankly, at the end of the day by many. For us, a few years ago, we realized that we were really good at building applications tissue by tissue. So we started in prostate. We've collected a lot of prostate data. Then we used a lot of compute. We've built an AI system for detecting cancer and prostate neural biopsies. Then we went beyond prostate to breast, and we started doing the same thing in breast with more slides. Then we went beyond breast and to colon, and so on and so forth. And at that point, we had a bit of a realization that maybe that was not necessarily the most efficient way of going at trying to solve pathology through AI. So we we have decided to try something different, and that something different was take slides from all the tissue types that we have access to and try and build a bigger baseline model that understands the morphology of cancer. So we started with 200,000 slides, which was a step up from what we had done before. Quite a large model back then. We had some really good preliminary results. We went to Microsoft and ultimately Microsoft Research, and we decided to scale the approach because our hypothesis that using more data, more diverse data, and building a larger system seemed to be true. And we went from 200,000 slides to a million slides. And ultimately, that really enabled us to build what we didn't know back then, which was a foundation model for pathology that truly understands the morphology of cancer. So that initial model called Virukov has been peer-reviewed in Nature Medicine, and we haven't stopped there. We have since then scaled again to use 3.5 million slides and even scaled the size of the AI network to close to 2 billion parameters to really build today the largest and most sophisticated foundation model in pathology. That for us started as a need, right? We really wanted to ultimately achieve better performance by having more slides and more data, but also speed up our ability to build products because we didn't want to have to retrain from zero every time we wanted to go from one tissue to the next. And I think those foundation models are in fact changing the way we can build applications in pathology, the very same way foundation models outside of pathology are changing other industries. The way to think about it is every time you're trying to derive insights from pathology data, you need to actually understand the data set itself. And ultimately, what you need to do is understand the morphology of cancer. Those foundation models capture that information. So instead of reinventing the wheel, you basically start from a baseline model that ultimately have an intrinsic understanding of images, and you're only focused on building your downstream application. Example, if you're trying to do cancer detection on a rare cancer, well, you could either collect a very large data set of those rare images, but they're rare, right? So you will never be able to do so, right? So that's very complicated.
Right.
So by starting with a foundation model, what you can do is you have this extremely robust representation of all cancers, right? And now you can use a very tiny data set on top of your foundation model to do cancer detection in rare cancers. And that is something that we've been able to do. So it not only enables us to build applications faster, it also enables us to build applications that historically were not necessarily possible to build. And that is changing also the space of, generally speaking, oncology, because if you think about biomarkers, biomarkers are that signature on images that may not necessarily be visible to the naked eye, but you need a lot of images and a lot of training samples to be able to identify those patterns. And by leveraging those foundation models, you capture all that information again, and then you can build a very simple other model or application on top of it that is specialized in identifying specific mutations, for example, which can then be used for doing things like clinical trial matching or as a mechanism to drive patients towards sequencing to really see what therapies will be working with them best, ultimately being better for the patients. So those models make a difference. I think there is a wide set of players out there. I wouldn't necessarily say they're all equal. We certainly take pride in what we've built, and we've done that very, very, very seriously for our own internal needs, but they certainly make a difference.
That's amazing. Like, I mean, I've heard before about how it increases the speed of development, But what you're talking about, using foundation models to help analyze like rare cancers, biomarkers, that kind of stuff. I hadn't heard of some of that before. So that's really interesting. I mean, this has the potential to impact a large number of patients.
Yeah, they do, right? And the amazing thing about it is that I don't think we've really explored everything yet, right? We're only just starting to scratch the surface.
Yeah.
In many ways, the technology is frankly ahead of our ability to use it on a daily basis to help improve outcomes for the patients. There are things and insights that we discover today that are mind blowing, right? Now, they're not necessarily part of the way you screen, diagnose, and ultimately treat patients, but it certainly will be part of a new way of looking at guidelines for patients with cancer in the future. Yeah, that's super exciting. Super exciting.
Yeah, for sure. For sure. You mentioned earlier a collaboration with Microsoft, and I want to talk about this for a little bit. Can you tell me a bit more about this partnership, how it works, and to support the expansion of AI?
Yeah, we have a really good relationship with Microsoft. It's a very large organization. They do a lot of things, obviously. Historically, for us, our partnership really had three components to it. The first one is we've always been very close to Nuance, and after the Microsoft acquisition of Nuance, we kept that relationship pretty strong. Nuance has a wide set of applications in the radiology space. And we looked at basically leveraging some of those synergies to build something together across pathology and radiology. The other element of the partnership is working with the Microsoft Cloud and the Microsoft Life Science team, I guess, to really be able to enable us to deploy our models in Azure, enable to have the models available in the model store in Azure as well, and really promote this idea that life science, biotech, health tech companies actually are cutting edge as well. And there is certainly a place and a home for being able to access those advanced technologies for people to leverage by themselves. And on the Azure side, we really work more with Microsoft on being able to ultimately deploy our technology at scale and reach as many customers as possible. The last element of the relationship, which is probably more interesting for the context of talking about AI, is our relationship with Microsoft Research. So we've been basically collaborating with Microsoft Research to continue to advance our foundation model technology and all the models that we've been building before. We have a lot of data. We have probably the best team today that focuses on AI and pathology, but being able to train those models takes a lot of compute, right? So we've been very fortunate to work with MSR so that they can bring in their expertise, their scientists, their compute to enable us to really scale our ideas and work collaboratively on advancing the field of AI for science, frankly. So it's been a very symbiotic relationship. We talk to them every day. In fact, I was just in Davos where they had a session at the World Economic Forum led by Microsoft and Microsoft Research, talking a bit about all the great things that is done in that division to advance, climate research or quantum computing or biology. And Paige was, in fact, one of the companies featured there as a very strong partner, where we together really advance the utilization of AI for ultimately something that's impacting people's lives and advancing the space.
I've been noticing a lot of, especially in this conversation, but in others that I've had this sort of collaborative idea or theme about it. Like in the beginning of digital pathology, everybody was kind of doing their own thing and had their own systems that didn't sort of cross over. And now different companies are working together. And I think it's helped to increase advancement and speed up things. Do you agree with that?
Yeah, I do. I think everyone in our space is really trying to ultimately change or improve the way medicine is being practiced, and specifically pathology is getting practiced. I think we all know that population is aging. There is an increase in cancer cases that is happening today. There is an increase in access to screening for cancer, which really identifies more cancers at the end of the day, rightfully so. The complexity of reporting on cancer cases goes up. There are more and more tests available. There is more and more information to report on. And the number of pathologists is going down, right? So we will be facing a crisis, right? Where there will be patients that will potentially and likely not get proper care because we will have a shortage of pathologists, and there is still an increase in cancer cases. So I think we all recognize that technology and AI and infrastructure and software is the solution here to really help the pathologists in their day-to-day activities, whether it's looking at images on a monitor instead of looking through the microscope, whether it's using AI to automate basic things like counting mitosis, measuring tumor length, spotting where cancer is to help you corroborate your findings, or even go beyond what they do today by looking at some of those biomarkers. So we all see it the same way. The challenge is pathology is not digital today, right? So by and large, people are using microscopes, and it takes time to ultimately move a bit away from the microscope and start digitizing those glass slides, get to images, manage them as digital samples, and ultimately apply AI. So the companies and the technology are a bit ahead of where the market is, right? And to some extent, those partnerships really help with consolidation, making it easier for customers, for buyers to make decisions on how to move forward. If you're a customer today, you have 5 scanners to choose from, 5 platforms to choose from, 5 AI providers to choose from, and it may not be very clear to them what's the right mix of solutions. How do you connect the dots? And it is the unfortunate fragmentation we are in today. And I think those partnerships really help consolidate in a certain way and make it easier for the better benefits of those labs and institutions trying to go digital and ultimately using our solutions. So yes, it started as being extremely, I guess, competitive and everyone being after everything to try and ultimately win opportunities. But more recently, there's been a lot more collaboration. And frankly, that is my stance also as a CEO. I think we really need to take that technology and bring it into the hands of pathologists as soon as possible. And the way to do that is by removing friction points. And if we can do that collaboratively as industry, we should. So that's been really good and very promising.
Okay. I like that. This is the People of Pathology podcast with our guest, Razik Yousfi from Paige. We'll be right back. If you think it would be nice to have a helpful reference about digital pathology, I have some great news for you. Dr. Alexander Zhurov has written a book called Digital Pathology 101. All you need to know to start and continue your digital pathology journey. This book will help you whether you're a complete novice or a digital pathology trailblazer. You can get a copy of it by following the link in the show notes. LabVine is an interactive online learning platform where laboratory professionals learn, develop, and discover by sharing knowledge and building on each other's experience. The platform provides global access to internationally accredited laboratory-specific courses and other resources developed by lab specialists like us for the laboratory industry. LabVine is free to sign up, and you can use the link in the show notes to get started. Now for the rest of my conversation with Razik Yousfi on the People of Pathology podcast. Can you tell me about the Virchow 2 models? Because these represent an unprecedented scale for foundation models. Tell me about this. Like, how does that support the role of pathology in cancer diagnosis?
Yeah, I think, it goes back a little bit to what I was mentioning earlier. We've built Virchow 1. Virchow 1 was really the first million-slide clinical grade foundation model, but it was only roughly a bit more than 1,000,000 slides, right? So that was a fantastic model, but it was not the biggest that we could do. So we continued on that journey and we have a lot more data. So the first thing that we've done is expanding on the size of the data sets, right? We've expanded to 3.5 million slides. We've included multiple stains. So basically H&E stains and immunochemistry into the data set. We've looked at different techniques to basically learn and train better. And ultimately, Virchow 2 was trained on the largest data set in pathology to date. But the size of the network originally for Virchow 2 was the same as Virchow 1. So we did not increase ultimately the ability, I guess, of the network to capture a lot more information. So then we created Virchow 2G, which basically leverages the same data set, but is a much larger network, which captures a lot more information. So 2G is not only the largest model by number of slides used, it's also the largest model by number of parameters, which ultimately captures more information. And we really look at 2G as today the springboard for building anything where you require really high accuracy, right? We strongly believe that 2G captures as much details as possible right now. We're obviously continuing to work in that work stream, but we look at that model as something that should be baseline for building any sort of applications in pathology.
Okay, I see. And now you've recently open sourced these models too, right? What was the reason for that?
Yeah, we've open sourced some of the models, not all of them, and under different licenses. So Viracov is open both for Viracov 1 is open source both for research and commercial purposes. Viracov 2 is open sourced for research purposes. We've also open sourced Prism, which is a different type of foundation model that doesn't only understands parts of the images, but really makes sense of whole slide images and can be used for things like automated report generation or zero-shot cancer detection. We've also open sourced Prism for research purposes. The main reason why we've open sourced those things are a few. The first one is we wanted people to be able to benchmark them by themselves. In other words, it's very easy for us to say, those models are great. They work amazingly well. You should trust Paige. It's a lot easier for people to take them, test them, evaluate them on their own, on their data, on their benchmarks, publish on them, and ultimately, give us feedback, all right? And tell us where they fall short and help us also educate what should be the next step. So in a certain way, we've done that to open the black box and enable people to trust a bit more the technology and not fear it, because we think it's going to have a very positive impact in the future. And the best way to do that is to make it as open as possible. The second reason is it goes back a bit to this idea of competition and partnerships. We've built amazing technology, and of course, we keep some of that technology in the house. But there are plenty of companies out there building applications in pathology, and the number of use cases in pathology is frankly endless. It's infinite. The number of applications you can build there is just massive. And we strongly believe that the entire ecosystem could benefit from a bit of a boost to build those applications faster. So if people can start from Viracov and not have to retrain their own foundation model, not have to re-understand the morphology of cancer, not have to resource like those amazing large-scale data sets, not have to go pay for the compute infrastructure to go train those models, I think it should be a win. It should be a win for the industry. It should be a win for them. It should be a win ultimately for the patients. So part of open sourcing that was, okay, how do we lift up the ecosystem together in a way that, of course, we still remain a for-profit organization and with the objective of ultimately being fully viable, but in a way that non-competitively, we can enable people to go help us advance the ecosystem.
Okay. That makes a lot of sense. So we were talking about efficiency, and now we're talking about sort of accessibility,
Yeah,
right?
exactly.
Yeah,
Yeah.
which helps.
Yeah.
Again, helps much more patients.
Yeah.
Yeah. Okay, let's go back a couple of years. I want to talk about Paige Alba, which was introduced in, I think, 2021. Tell me about this.
Yeah, we've introduced it, in fact, last year. So
okay.
Last year.
2024 then.
2024. That's right.
Okay.
We look at Alba as really the way ultimately pathologists will be interfacing with all of this amazing AI. So if you think a bit about it today, when people shift away from the microscope, they typically start using a viewer and a platform. The way to think about it is you log in, you have a list of your cases, you click on the case, you end up on a viewer, and then you can start looking at images there. Pretty straightforward. And then you ultimately, as you're browsing images, you can click buttons and AI highlights areas that you may be wanting to take a look at. You can select other regions to measure things within them and so on and so forth. But it remains a very active process of interacting with the AI. Our intuition is it's great for now, but it is probably not the way you're going to be thinking about AI interaction and frankly, pathology and AI osmosis in the future. And we're thinking more along the lines that this should be a little bit more immersive, and it should probably take more of a form of a co-pilot where you're actually not clicking on buttons to know what AI to use, but you're really interfacing with the AI system. And the set of agents can ultimately figure out the question you're asking and go and use the AI that you may be wanting and ultimately give you that information back. So Alba is basically a clinical grade copilot for pathologists that really is an AI agentic system that combines all of the foundation models that we've built, combines all of the AI assisted diagnostic suites that we've built, including our FDA approved products, CIVD products, RUO products in the US, and combines large language models to basically create this experience for the pathologist where they can interface with the AI with the ultimate goal of automatically generating reports. And the way we think about it is as you're having that interaction via text or via voice, the report automatically populates and you just have to review it. So you're moving a bit away from that active interaction with AI to identify small things on slides and everything to this conversation with a set of AI agents that ultimately help you automate your work such that you can sign off on cases faster. And we think that is the future of healthcare. We think that's a future where diagnostic modalities are a bit more integrated and where ultimately we can provide that as a unique point of entry for the pathologist to assist them on their day to day.
This is something I like to stress anytime I'm talking about AI. Now, you call this a co-pilot for pathologists. So I want to stress, like, this is an AI assistant, not an AI replacement, right?
That's exactly right. That's precisely an AI assistant, right? So the pathologist is still in the driver's seat. They're the ones sending off the cases. It's their expertise. They can also disagree with some of the AI findings. And ultimately we help identify things and quantify things on images, and that information is provided to the pathologist for them to make a final decision.
Okay, I like that. All right, you mentioned that with foundation models in particular, we're kind of right at the beginning of all of this. So let's kind of look into the future, maybe 5 to 10 years. Like, as this technology evolves, what do you think that's going to look like? How far is this going to go?
Yeah, we're almost having it's almost a philosophical question at this stage, right? I think that goes even
Right.
beyond pathology. I
Mm-hmm.
think there is certainly this idea that, generally speaking, AGI is not all that far, right? So it may not be next year, it may not be 5 years, it may be within, within 10 years. We don't exactly know, right? But ultimately, there is this general concept right now being talked about in the whole AI community that systems are becoming smarter and smarter. They can make more autonomous decisions and so on and so forth. And I personally, I'm a believer that it is not something to be worried about, but more something that we need to embrace because the combination of humans and AI achieves something that's greater than what we can achieve today. And we already see it, right? If you use an AI system to help you write your notes, well, you write your notes more efficiently. If you're using an AI system to help you navigate from point A to B, well, you usually navigate from point A to B a little bit more efficiently. So I think the emergence of more intelligent AI systems in general in the world are going to be beneficial to us as humans, as long as we know how to interface with them. I don't think it is necessarily different in healthcare. I think the one thing that I want to say that is a bit different in healthcare is we need to ensure that those things are properly regulated, that are safe and effective to ultimately serve patients. And that is something that I expect is going to get a lot of attention by regulatory agencies and governmental agencies over the next few years. Now, what are we going to be able to achieve? It's a good question. I think it's certainly going to be along the lines of more automation for things where humans don't necessarily need to intervene. It does not mean the human is completely out of the loop. It may just mean that we agree to say yes to a case that's been fully reviewed by AI first. I also think that where AI is going to be playing a huge role is in being able to bring together modalities that are sometimes today difficult for someone to bring together. So if you think about yourself as a patient, your entry point is your GP, right? You go there, you have symptoms, and then that person refers you to a first specialist, and you may be getting screened for something, and you may be seeing something on an X-ray, on an MRI, on a mammograph, and then you're getting referred to another specialist, and now you may be getting a biopsy, and you get those flashlights created, and now you look at them through the microscope, and maybe there's a finding, and you get referred to potentially somebody else, and you get more testing. That journey is very long, right? That journey is very long. It's very long in cancer care. It's very long in, frankly, most of the healthcare specialties. And it's very stressful for us as patients. It takes time to get an answer. It takes time to get to the right therapy. It takes time to know what you're going to be doing with your life. And not only that, but I think it is very complicated for any human to make sense of all the data and the insights generated along that journey, right? So you have notes from your initial visit, you have images from the radiology, you have images from the pathology, you have sequencing data, and then you have all these opportunities to look at predictive and prognostic tests that may enable you to identify whether or not you could qualify for a specific therapy or drug. Making sense of all that data together is extremely complex for us as humans. Training AI solutions that can make sense of that and ultimately give better insights to your oncologist to help you ultimately get a better answer as a patient is something that I think is the future. So I really think there's going to be advances in each specialty, but I think there's going to be advances in whole disciplines of medicine altogether for ultimately better again patient care, but also better patient outcomes. Is it one foundation model? Is it multiple foundation models combined in a certain way where you can actually make sense of pathology and radiology data together, pathology and radiology sequencing data together? I think that's what we're currently investigating as research institutions and industry.
Yeah, that is fascinating. Like the potential of all of this stuff is just endless.
Yeah.
It seems. Okay, last question. I want to end with this because you mentioned earlier that most pathology labs are not digital.
Yeah.
I'm curious on your thoughts about how do we fix that? What would you recommend to improve the speed of adoption
Yeah.
of digital pathology?
Yeah, it's a very good question. And of course, we don't have a good and precise answer. Nobody does at this moment, because otherwise I think we would be digital.
Right.
I think to some extent, there are things that we can do and that we've been doing through partnerships, right? So being able to bring a scanner vendor in a discussion with someone that wants an AI solution and really fast track this ability to make a buying decision by not necessarily looking at 12 different options. So partnerships are definitely something that help. But I think ultimately, I think there are two reasons why today pathology is not digital. Number one is those scanners remain somewhat expensive. And today, most institutions have to buy them out of pocket. They're not reimbursed. Reading on digital images and using AI is not reimbursed. And ultimately, a lot of that money has to be spent out of pocket. And that's a pretty significant capital expense for an institution that, don't get me wrong, can be justified, right, through some of the gains that you see, right? You see efficiency gains by looking at digital images and moving away from the microscope. You see efficiency gains by leveraging AI solutions as part of your workflow. But it is not as straightforward as saying, well, now if I use AI, I'm getting reimbursed, so I can go and justify my spend on that particular scanner. So I think the general capital expense, budget, payer, provider ecosystem needs to ultimately figure out what are the mechanics to go pay for those new instruments. The second thing is that leveraging those advanced solutions is not standard of care at the moment, right? So it is you as a pathologist, you as a lab that's deciding to ultimately bring AI into your lab because you can do better as an institution, right? You can probably increase your volumes, you can process more cases, you can likely increase your diagnostic accuracy because you can use AI as a second read, for example, and so on and so forth. But it's not mandated by any sort of guidelines whatsoever, right? So the justification for going digital and using AI today is purely driven by the individuals and the institutions themselves, which which makes sense. We're still fairly early, but that is something that will evolve over time. So the infrastructure today that is really enabling people to go digital and use AI is not completely there. And I think it has to be a combination of figuring out budget and ultimately figuring out what is standard of care moving forward.
Okay, I like that. I like that a lot. Razik, I appreciate your time. This is a super interesting conversation. This kind of stuff, I could talk about this all day. It's very exciting for me personally. So I appreciate getting the chance to talk about it with you. Razik Yousfi, thank you very much.
Thank you, Dennis. Thank you for having me. Thanks for a lot of the insightful questions.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Dr. David Klimstra as we talk about using AI to determine HER2 status.
So there's a pretty easy, a direct line between the nature of the genomic alteration and the morphologic manifestation of results. AI enables us to potentially pull out things that pathologists may not have recognized yet, that are related to the underlying genetic alterations of cancer, but they're manifested in a change in tissue architecture or cellular structure. So to get back to HER2 expression, do we know why HER2 negative cases have a different histology than HER2 positive ones at a mechanistic level? Well, perhaps not. But the fact is they do. And AI was able to be trained to recognize those differences and predict which cases are truly negative.
You can hear more from Dr. David Klimstra in episode 163. Okay, big thanks to Razik Yousfi. So in this episode, we looked at the importance of data quality in AI and how Paige is committed to creating models that represent diverse populations. Razik highlighted the unique data set that they have access to, which includes millions of images from over 800 institutions worldwide. As we said, AI algorithms are only as good as the data on which they were trained. A significant portion of our conversation focused on foundation models, particularly Paige's Virchow models. I found this part to be really fascinating. Foundation models are trained on a vast data set that can include a wide variety of features, multiple cancer types, for example. From that, you get the general morphology of cancer. Then you can build on top of that foundation model with something more specific. Razik mentioned how this can be done with rare cancers. It's virtually impossible to create a large data set of a rare disease, so you can use a foundation model for the base, the general information, and then build a model of rare cancers on top of it with a smaller data set. This is a really innovative approach, and I'm curious to see the progress that comes out of it. We talked a little about the collaboration of Microsoft. I think this has two important implications. One is the access to the resources of this massive company. That has to improve your ability to innovate and push the boundaries of what can be done. The other important implication, which we didn't really talk about, is that Microsoft is outside of pathology. This makes me wonder if more outside companies are noticing the importance of pathology. Maybe that leads to more interest in the availability of more resources to increase advancement. It's something interesting to think about. Razik highlighted Paige Alba, which he described as an AI co-pilot for the pathologist. This system is a set of AI agents that acts as an interface between the pathologist and the AI. So you can use voice or text to have the AI complete tasks. You can have the AI populate data points into your reports, and then you just have to review it. All of this sounds like a good way to increase efficiency and accuracy. But let's be clear about this. It's not meant to replace the pathologist. It's an AI assistant for the pathologist. As Razik said, the combination of humans and AI can achieve something that's greater than what we can achieve today. So then, if we look toward the future, what might that look like? Well, first, Razik stressed that all of this needs to be properly regulated. And that's a really important point. Also, there needs to be an efficient interface between the pathologist and the AI, something like Paige Alba, for example. The really fascinating thing that Razik brought up here is the integration piece. So you'll be able to integrate data from multiple sources in one place. You'll have your digital slide data, of course. but also radiology data, molecular data, genomic data. And then, if you take that a step further, the AI could determine if that patient qualifies for a clinical trial, or if that data might be useful in drug development. There are so many possibilities for how this could improve patient care. As always, I'll have links in the show notes to everything that we talked about today. Don't forget you can follow the show on Twitter and Instagram. I'm at People of Path, or just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.